Welcome to yet another interesting episode of Lifestyle with D, where we discuss matters health, where we encourage you to stay healthy because your health is your greatest wealth. Today we are honored to have one Dr. Caroline Mwendwa, who is a chiropractor, and she will be telling us more about what all that entails. So if you have any feedback or questions, kindly send them on our SMS line 20058 or my Twitter handle @DDMyes. Thank you so much for joining us today.
Thank you for having me.
Yeah. So today's topic is chiropractics, something that not many people are aware about. But before we actually get into that, you work with Wema Group. Could you tell us more about Wema Group?
Yes. Wema Group is a company that offers healthcare services. Chiropractic is one of the services we offer. And it entails taking care of people's neurospinal problems, which means problems with your spine, nerves, and other bones and joints without the use of drugs or surgery.
Yes.
Then we also offer physiotherapy, which I think is more common. Many people know because physiotherapists are many and they're in hospitals all over. And this is primarily concerned with restoration of movement and function. So if you have joint problems or you're recovering from surgery and you need to rehabilitate, physiotherapists do that work.
Okay.
Then we also offer psychotherapy, and specifically we want to target males who are struggling with substance and alcohol dependency on an outpatient basis at the moment.
Yes.
And we offer nutritional counseling as well, because we are what we eat.
Definitely.
And our bodies cannot heal if they're not being fed properly.
Oh, yeah.
So most of our services are done in a holistic way, where a person gets assessment of all those different systems and receives a prioritization of what their problems are and receives the appropriate treatment. Our goal is always to steer you to better health and to empower you to take control of your body and your health. And if you can do it as drug-free as possible, and avoid major operations, then that's what we strive to achieve.
Okay.
Now, don't get me wrong.
Okay.
We know medicine has a place.
Definitely.
There is no chiropractic that's going to get rid of a bacterial infection. You need antibiotics.
Yes.
Yeah, so there are times when a person does need to go and see their medical doctor, does need treatment with medical options, and we always refer when somebody requires that.
Okay.
And so that's why we exist. So we're very unique in the offering that we have, and we're very happy to be able to serve Kenyans with those particular services.
Okay. So how long have you done this for?
I've been a chiropractor for 11 years in Nairobi.
Wow.
Yes.
Yeah. Did you study chiropractics here?
No, unfortunately, there is no school that teaches chiropractic in Kenya.
Okay.
Actually, in Africa, there are only 2 schools in South Africa. The rest of Africa does not have any education for chiropractic. So it's extremely underserved on the African continent.
Yeah.
The Chiropractic Association of Kenya, which is active at the moment, is really working hard to start a program, a degree program.
Yes.
And we are hoping that it's going to begin next year at Kenyatta University School of Medicine. So at least we will have more chiropractic doctors available to serve Kenyans.
Yeah, because I hear there are like 10 chiropractors in the country, is it?
At the moment, yes. And that's a lot for an
That's
African country. Apart from South Africa, where there are 600 or 700, the rest of Africa has 12, 2, 3, none. And so we are 10, but we're 10, some are part-time. They come and go. So we're actually 8 who are here full-time in practice.
Why is it that it's a career that not many people really know about it? Is it that in med school here they had no idea about it, or why?
Yes, that's part of the problem is ignorance, because people just have never heard of it. Medicine is 2,000 years old. People have practiced some form of medicine all along. And chiropractic was actually naturally a part of medicine from way back. But as an established profession on its own, it's just barely 110 years old.
Wow.
So it's not as widespread as mainstream medical practice, which we call allopathic medicine.
Yes.
So we have it very well developed in, America and
countries,
Europe and Australia, and chiropractors work in hospitals and side by side with other medical practitioners. But in Africa, it just hasn't hit yet, and mostly because of lack of education.
Education, yes.
Yeah, so that's what we're really working hard to do.
Okay.
Yeah.
So, chiropractics, could you now tell us in detail really what it involves?
Okay.
Yeah. Yes.
So chiropractic is actually a word rooted in Greek. Chiro means hands.
Yes.
Practic means practice.
Yes.
So we use our hands to actually physically manipulate the bones and joints to free up the nervous system.
Yes.
Because the nerves are encased inside your spine.
Yeah.
That's where your spinal cord runs.
Yeah.
And every nerve that goes to every part of your body comes out of that spinal cord. And it's the way that the brain communicates with the body on how the body is going to work. So if the nerves are under pressure, because the spine system is not well balanced, then something in the body is not going to function properly. So our job as chiropractors is to look for those places that have nerve interference or nerve dysfunction and free them up by doing spinal manipulations, or we prefer to call them adjustments.
So you do that with your hands?
With our hands.
Yeah.
Some of us also use certain instruments that assist with that adjustment.
Yeah.
So it is very simple, and it's painless, and it's non-invasive, and that's the thing that people look for.
Yes.
Because most medical treatments are invasive.
Yeah.
Either you're taking a chemical in, which is a drug,
Yes.
which is a chemical invasion, or you're getting an injection, or you're getting surgery. All those are quite invasive.
Yeah.
Chiropractic is not. And if it can give you the relief from pain and restoration of proper function for the long term, that's why we're here. That's what we do.
Yeah, there are those, let me say, probably medical practitioners or someone else, any ordinary person, who would confuse that with probably the massages that I've heard of some medical facilities that offer such kind of massage to relieve the nerves. Would you compare that with what you're doing?
Yes, let me tell you, there is confusion.
Yes.
There's confusion between what is a chiropractor,
Yes.
what is a physiotherapist,
Yes.
what is a massage therapist, when do you see who, and what are they doing,
Exactly, yes.
okay? The first difference is level of education to start with.
Yeah.
Chiropractors are doctors. The minimum education currently is 6 years, just like a medical doctor. And in most countries, it's 8. You have to have 2 degrees.
You did 8 years yourself?
Yes, I did 8 years myself. You have a bachelor's, and then you have the Doctor of Chiropractic degree. So similar to a medical doctor who goes to school in the US, will also have a bachelor's, and then will go and specialize in medicine, right?
Yeah.
So there is that higher level of education where we are primary care physicians. So anybody can walk into my clinic from the street, and I'm able to diagnose any problem that they specifically have, and able to manage specific things, and those that I don't manage, I'm able to then refer to the appropriate healthcare professional.
Okay.
Physiotherapists work with the physical body. They are physical medicine people, and they are there to do rehabilitation of a person, for instance, who's had a stroke, or after an accident, or after a major surgery, of the physical musculoskeletal system, to restore movement of the musculoskeletal system. And we work with them. I have them in my office to help rehabilitate the spinal problems that people have had for a very long time, even after correction, with a chiropractor.
Okay.
Then massage therapists have even less training than that, and they simply do stimulation of the muscle and connective tissues to loosen them up, improve circulation, and release tension from the muscles. So all are very useful, but massage therapy is usually not clinical.
Yeah, exactly.
Whereas physiotherapy is clinical, and those are the ones you find in the hospitals. And chiropractic is also clinical, and we're not yet in the hospitals because we're very few, but we will be when we increase in number. Yes.
We hope so.
Yeah.
Okay, so what you're saying is that I could be going through some pain that I don't necessarily need to go to hospital, that can be dealt with some sort of other way, instead of going probably through surgery, that you can correct?
Yes, absolutely.
Yeah.
And the public needs to have confidence that when they walk into a chiropractor's office, the chiropractor is going to follow the same physical examination procedures as any other medical doctor.
Yeah.
So we know how to examine your nervous system. We know how to examine your physical system. We will be able to order your lab tests if you need them, or x-rays or MRIs, and interpret them and know what the diagnosis is for you. So that if it is something internal, for instance, kidney problems will cause some back pain.
Okay.
Yeah. So you might come to me thinking you have a backache.
Yeah.
And then after some tests, we find that you actually have a kidney problem. So then I would immediately refer you to the nephrologist who takes care of kidney problems. So that's the way it works. And that's the way it works in the healthcare system. This is why specialists exist, so that a specific doctor is very well versed with a specific area of the body and is able to take care of that part of the body. Chiropractors are primary spine care physicians.
Okay.
Yeah.
We're talking about chiropractics with our Dr. Caroline Mwendwa, who's a chiropractor, and she's telling us more about that. So we will be taking a short break. If you have any feedback or questions, kindly send them on our SMS line 20058. We'll be right back. Welcome back to Lifestyle with Dee. We are talking about chiropractics with Dr. Caroline Mwendwa, and she's telling us more about this, what it all entails, especially being alternative medicine. And many people would have the challenge of thinking, alternative medicine, what is all that you're talking about? Because many people have so many thoughts. So what are some of the challenges that you've had through the years that you've practiced?
That categorization is actually one of the main challenges,
Yes.
Because there is a group of practices that is called complementary and alternative medicine, or CAM practices. These include everything from traditional healers and herbalists and acupuncturists, Chinese medicine, Ayurvedic medicine, homeopathy, so many different practices that are actually in existence even here. And chiropractic is put in that category with those practices.
Yes.
Now, part of the reason we have a problem is because chiropractors are highly, highly trained, as I've explained already, to the same level as the medical doctors.
Yes.
And we utilize so much of the medical system to do our diagnosis. And the treatment plans that we offer are really following specific guidelines and protocols that are very much in line with similar protocols that other specialties would use in mainstream medicine, if you will, because that's what people do. So those categorizations create a problem.
Yes.
Because when somebody says, I'm going to the chiropractor, that's an alternative medicine doctor, the first thing somebody thinks about is the herbalist, or is it a witch doctor? Is it a traditional healer? They're going to step on your back. Like some very strange things come to mind.
Yes.
And that's not accurate at all, you know. So we actually have a little bit of a problem there. So I think chiropractors sort of straddle the line because we don't prescribe drugs. And as much as possible, we try to help people avoid surgery.
Drugs,
Now, there are times they need it, and there are times we will refer for it. So because we don't deal with drugs and surgery, we're called alternative. However, we're dealing with the exact same medical system of diagnosis and examination and everything else. So we're really not alternative.
Yes.
So our preference is actually to be complementary.
Complementary, that's a better word.
And work in conjunction with.
Yes.
I get a lot of referrals from medical doctors.
Okay.
And I refer a lot to medical doctors.
So they do recognize that they need
Yes,
you,
yes. I work very closely with certain spinal surgeons
Yes.
because there are patients who are actually beyond the conservative
Surgery.
management that we do and
Yes.
actually need that surgery. And there are some who are then referred by those same surgeons who say, look, you're not ready. This is not surgical.
Yes.
Go to the chiropractor first. Yeah, so we do have a lot of back and forth referral, where I suspect that you don't have a lot of back and forth referral between
Yeah.
the surgeon and the herbalist.
Oh, yeah.
You understand?
Yes.
Or the cardiologist sending you to the traditional healer. That I think
It
doesn't
can't.
happen very
Yeah,
much.
yeah.
So that's some of the challenges we faced was that. Secondly, obviously, lack of education
Yes.
of the public. Patient education is not there. Lack of education of doctors,
Yes.
where we don't have enough chiropractic doctors coming out of school and coming back to Kenya to practice. And then our colleagues, doctors, who don't know exactly what we do.
Exactly.
So they can't advise their patients when they need us.
Yeah.
And then there's a problem because in this country, we don't have the legislation yet.
Oh, yeah.
For chiropractic. There's no Chiropractors Act yet, but
Yeah.
there will be. We're in the process of processing that, where in other countries it exists. So people's health insurance does not yet recognize, not everybody,
Wow.
some health insurances
Oh,
do,
yeah.
but others do not.
Oh, my
So people want to use their health insurance when they
But
go
they
to the
can't,
doctor,
yeah.
but sometimes they can't. So there are these challenges that come across where somebody has to look for the money to come
Yeah.
and get the treatment they need and then fight with their insurance company later. Then there is problems with perception because of this whole categorization
Yes,
with,
yes,
where we
yeah.
have to fight that all the time.
Yeah.
So being a chiropractor is not easy,
It's not.
okay, because you have to be above and exceed a lot of expectations
Yes.
that people have, but we love what we do.
Yeah.
We have a passion for it, and therefore we try to do this where we speak to the public, let them know what's there, let them understand who we are and
Yeah.
why we're here to serve them.
Okay. How has the Ministry of Health taken up this?
Actually,
the whole- yeah.
right now, very well.
Yes.
For a very long time, they didn't have any understanding of what it was.
Yeah.
And government wheels move very slowly.
Very.
Okay. So
Yeah.
it's been several years
Yeah.
of working with them, talking to them, meeting with them. And they keep changing officers.
Oh my
so you
gosh.
start again from the beginning
It's a struggle.
to get to where they recognize who we are and what we do.
Yeah.
But they've now reached a point where they have understood who we are. They license us to practice. They have stood behind us in the sense of when the legislation is passing through, they are ready to sign off. When education is starting, they have given their go-ahead, and they recognize it as a genuine, proper healthcare profession with highly educated doctors.
Yeah.
So it's been quite a challenge, but we've been so happy to find some very wonderful people in the Ministry of Health who've been willing to listen, who've been willing to walk with us, travel with us to visit places where it's established,
Yes.
and understand
And-
what it is.
Yeah.
So it's been really good. So right now we're in a good place.
Okay, it's
Yeah.
important. So besides the whole chiropractic making use of your hands, are there any other equipments that you use, and where do you get them from?
Yes, chiropractors do use specialized equipment.
Yes.
We call them chiropractic tables. Some people call it chiropractic bed. It's the instrument that the patient lies on top of.
Okay.
And it has various functionalities and
Yeah.
certain levers and areas that move to help us accomplish that adjustment or
Yes.
movement of the spine that we're talking about. Those are not available in Kenya. They are not manufactured here at all. We have to import them. So it's not cheap. It's not
It
easy
must
to
be very
have.
expensive, yeah.
Exactly.
Yeah.
Then there are other chiropractors who have specialized techniques, who use specific equipment for these adjustments that they do. And some even as far as needing specialized x-ray equipment on their premises,
Yeah.
because the chiropractic x-rays that we take are sometimes quite different than what the medical profession generally takes, and very, very specific. So depending on the technique that a chiropractic doctor focuses on, because there are very many different techniques, they will have different types of equipment within their office. Yeah, so similar to a dentist. When you go to a dentist's office, you don't expect to see an examination couch like you find in the general practitioner's office. You expect to see a dental chair with all these little drills and other little funny little things, which you don't necessarily know, but you know a dentist needs them. Similar in a chiropractic office.
We talked about the people wanting to use their insurance, but they can't. Is it affordable to visit a chiropractor?
Yes, it is. It's definitely more affordable than swallowing medicine for a long time or going for surgery. That's for sure. Generally, a chiropractic visit will cost anywhere from 1,000 Kenya shillings all the way to, there's some who might even charge 10, depending on what it is they're doing. So with the oath that we take to take care of people, money is not a so the first thing we do is recognize you have a need, and most of the time, most of the doctors are willing to work with you and give you a lower price and work something out to make it possible for you to get the treatment you need. Oftentimes, we will have insurances who actually don't cover chiropractic in their list of services. But once we write a detailed report of what's going on and what this patient needed and why, then they start to reimburse. And there are some who actually cover it outright and have no problem. So the patient doesn't even come with money. We just, exactly. So we're still in the process, and we hope that more of them will pick it up, because at the end of the day, the ones who have picked it up have realized they're spending less money. Because these people come in, maybe they have 3 or 4 or 5 sessions with us, and they're functional again. They're back to work. They're living life. Whereas they may go to the medical doctor and be admitted. How much is that costing the insurance company?
A lot.
A lot. And then they go through hospital physio, and a lot of times those are written 10 sessions, 15 sessions. How much is that costing the insurance company? If I can solve that problem for you in 5 sessions, if you avoid surgery, which is going to cost you 800,000 shillings or 1.2 million, bottom line, it actually helps the person and the insurance company at the end of the day.
So even the health insurance companies should really be educated on this.
We're trying to educate them.
Is there any other way that you're doing public awareness?
It's been very difficult because, you have to go door to door knocking on some of these doors to speak to the right people in the insurance company and actually tell them, look, I have, 5,000 of your clients who come into my office every year. And this is what we do for them. So can you perhaps consider covering them for this service and give it a trial and see whether you're saving money on this person or not. It's been very difficult to get them to see the bottom line. International insurances have no issues at all. Because they are based elsewhere and it's already established wherever they are. So we're hoping our local insurances are going to catch up and pay attention, because if we can give you cost-effective, good outcome treatment, why not?
Exactly. So in an ordinary day, how many patients would you get?
Depending on how I want to run my day. I prefer to run on an half-hourly appointment basis. And so I can see 15, 20 people a day.
So as we wrap up the show, you could probably just give a piece of advice to patients out there who especially have no idea about chiropractics, and also those who just assume it's some other sort of alternative medicine as opposed to complementary.
My take-home message is going to be, your spine is extremely important. It is the house of your nervous system, which takes care of all the functions of your entire body. Do not wait until it is in pain to get it attended to. Get your spine checked once a year, just like you do a medical checkup once a year. Have your children checked. Have your elderly people checked. Chiropractic is applicable to all ages because everybody has a spine. And do not be afraid of the chiropractor. Nothing we do is invasive, harmful, or dangerous. It is very simple, straightforward, and very effective. So please take time to call us. I serve as the secretary of the Chiropractic Association, so I know where all the chiropractors are, and will be able to direct you to one who's closest to you to get your spine checked.
Definitely.
Yes.
Do you have information on your website as well?
Yes, you can go to www.wemagroup.org for information on Wema Group, and you can go to www.kenyachiro.org for the Chiropractic Association website, which tells you about all the other doctors as well.
Yes. All right, thank you so much for all that information.
You're very
I'm sure
welcome.
we have changed someone's life, and they will definitely be calling you. If you have any feedback, questions, kindly send them on our SMS line as well, and also visit the websites that she has mentioned. This has been Lifestyle with D. Thank you for watching. Keep it WTV.